Annie.
Hi, I'm Sean.
And I'm JB.
Thanks for coming to our presentation on Lyme disease in Milton, Massachusetts.
We decided to base our community care plan on Milton, Massachusetts, located in Norfolk County, just south of Dorchester and Mattapan. It's a very nice area. We chose this location because it's laid outside of the city landscape and allowed us to explore a different perspective than most areas surrounding Boston. In addition, we enjoyed that the community had natural parks and forests that gave it a more residential, homey feel rather than the condensed feel of the city. Based on information we gathered from the CDC and Milton's government website, the top 3 health concerns in the community were smoking, cases of COVID-19, and vector-borne illnesses, which is what we decided to focus our research on. Through our assessment and our research, we chose to focus on developing a plan that managed the increasing prevalence of Lyme disease originating in the forest that it shares with Braintree and Canton to the south. Lyme disease is a vector-borne disease, meaning that it's spread through infected parasites that reside in the community, which in this case would be from ticks.
Commonly spread by the deer tick, the bacteriums that are associated with Lyme disease come from 2 different types of bacteriums, actually. The primary one that's most well known is Borrelia burgdorferi, while the lesser known one, Borrelia mayoni, both bacteriums carry the equal risk of carrying the Lyme bacterium. So if you're bitten by an infected tick, like our friend here, signs and symptoms can develop as soon as 3 to 7 days, or as late as 4 weeks. The real way to know if you've been bitten by an infected tick before you run around and go freaking out, after you get bit by the tick and remove it successfully, you'll notice the development of a bullseye pattern rash, like right here. That's usually the first sign seen, and as that develops and takes shape, you will develop flu-like symptoms that can manifest, especially lethargy and joint pain. Now, based on our research, we believe that with careful implementation of our plan, we can increase the public's knowledge of the disease and work slowly to reduce the occurrence of symptoms. Our overall goal, obviously, is to help reduce the reoccurrence of Lyme disease short term over a 6-month period. We would like to see a decreased occurrence of around 10%. And while we upkeep that over 3 years, for our long-term goal, we'd like to see a decrease of about 30% of all cases when compared to the years previous.
To help implement our short and long-term goals, we designed a plan using the 3 levels of intervention to make things easier, to speed things along in a swift and efficient manner. First, for primary intervention, we agreed that increasing the community's knowledge of the prevalence of Lyme disease would be most effective. This will be done through the use of information sessions and visual aids, such as hanging signs outside the 7 parks and forest trails in the town, as well as sharing posts on social media. Information would include how the disease is spread and how individuals can prevent contracting it, such as avoiding straying from the trails, using insect repellent with 20% DEET. In addition, to stress the importance of conducting spot checks before leaving the parks and going back to their homes. Our secondary intervention revolves around the immediate treatment after a tick was found on one's body. Since not all ticks carry Lyme disease, a screening test should be taken first, followed by a preemptive course of antibiotics. Doctors and nurses should educate their patients to take a full course of medication, as well as follow up a few weeks later with another blood test to ensure that Lyme disease does not develop. Lastly, for tertiary interventions, these would revolve around treatment and management for individuals who test positive. Such interventions would include developing a 2 to 4 week antibiotic treatment plan to fight off the infection and managing any pain that occurs with over-the-counter medications such as NSAIDs. In some severe and untreated cases, there's a possibility for the development of post-treatment Lyme disease syndrome, but it is not permanent and can still be managed with antibiotics.